Hello and welcome. I'm Dr. Sonali, scientific editor for the Spark Kaho. On the occasion of World Patient Safety Day, we are bringing you a special podcast around this year's WHO theme, which is patient safety from the start. Every child deserves safe care. We are delighted to welcome Dr. Suneel Mundkur, professor in Department of Pediatrics, Kasturba Medical College, Manipal. So, sir, let's start with a little bit about yourself and your journey as a pediatrician.
Thank you, Dr. Sonali, for regarding this issue usually for pediatrics and our patient safety. I am professor of pediatrics working in Kasturba Medical College, Manipal for the last 7 years or so. I joined this institution as a lecturer in 2000, and for the last 25 years, I am in teaching faculty in this hospital, which is attached to Kasturba Medical College, Manipal. And I am into pediatric profession since the era of 1995 when I joined for post-graduation in pediatrics, and I did my DCH in pediatrics, then another 2 years of DMB in pediatrics, and then from 2000 onwards I am working in this organization. So my actual pediatric service for the last, I can say, from 1995 onwards, that is almost like 30 years of experience in pediatric field, and I still really enjoy being a pediatrician rather than any other branch of medicine, for the simple reason that the job satisfaction you get in pediatrics is something unique which you don't get in any other branch of medicine. If you treat an adult as a physician, let's say adult patient, say gastroenterology or cardiac or respiratory medicine, when you go to the patients every day, there will be some complaint. I have not passed stools, I have not passed urine, I have not, this plaster is itching, and so many other things. Or if you are a surgical patient, then again the same complaint, still the patient is discharged. Whereas if we reduce the respiratory rate of a child who is having severe respiratory distress from 80 to 60, 60 is still higher for that age, but if we reduce it by 20, when you go for the rounds, they smile at you. That's the gratitude which we get as pediatricians, and that is something unique to this branch of medicine, and I really enjoy it.
So, sir, what do you think that, like this year, we are focusing on the safe care for every newborn and every child patient from the start. So, as a pediatrician, what does this theme mean to you?
This is most often we don't, uh, we understand that this is the most challenging task for pediatricians. If you see an adult physician or a ENT surgeon or a physician, they will treat all other patients, including gynec patients, including gastroenterology, cardiac, nephrology, everybody. When it comes to their own children, they come to pediatricians. They don't treat, they don't take to. However, some adult doctors treat the children as half adults. So they give half tablet of paracetamol, half tablet of an antibiotic, half teaspoon of sugar, syrups. So the effect is either these drugs will be useless or toxic. This is the age group which is very vulnerable. As you rightly said, they have a very adventurous behaviors. They explore the nature like anything. And more importantly, they are dependent on most of their aspects on the parents, elders, or the caregivers. And they have a conditioned mobility. For example, if you are asking in the safety aspect, let's say the newborn is getting burnt because of the warmer, he cannot express or he cannot move away from the warmer. A newborn, he has to stay back there. At the same time, the child who is say 3 years old, 4 years old, without experiencing what is heat and cold, he will not move away from it. Or they have an adventure where they move here everywhere, and they don't know what is being shown in Chota Bhim is true, and they jump from top to bottom everywhere. So they have that adventure, and they don't have that experienced mind. Their mind is still inexperienced, and they need to learn sometimes from the mistakes, sometimes from others, sometimes from elders, and their mind is like a sponge. They extract everything, and that is a unique feature when compared to adult medicine you see in pediatrics.
I totally agree, sir, here. So, what do you think? What are the most common risk or harm children face in healthcare setting and how they can be prevented?
This is a very, very challenging topic, and I can talk for one full day on these aspects. Let me try to concise this to get you one. so
Sure.
that it is easy to understand. And you need to understand that what I'm going to talk is not related to general hospital safety issues. These are very, very unique to pediatric safety issues. So one important thing is infrastructure. Infrastructure. I'll start with infrastructural safety. Very, very important, because if you go to an ICU, you'll have small cradles in the NICU. So we assume that there is a lot of space in between the cradles and in between the beds. So we tend to move, especially those who are working in the adult wards. They tend to move very fast and get the stretchers and other things in between and there are a lot of mishaps that happen because of this. The ventilator disconnections, the monitor disconnections, pulling of the accidental delining, etc. So this can happen, and you should be very, very careful in such infrastructural issues, which are one aspect of safety. Probably interventions, the second aspect, where the patients are, when compared to adult medicine, there are lots of interventions, especially in ICUs. We do subdural taps, we do thoracotomy, we do intercostal drainages, we do umbilical venous catheterizations, umbilical arterial catheterization, arterial lines. So if you see a newborn, it will be attached to many wires and bundles. So you need to be very, very take care of these interventions also when you do the procedures. Then instruments, they have to be unique. They have to be neonatal and pediatric oriented. For example, the alarm, if you set for 70, so say 90 heart rate for an adult, may be normal in a newborn or maybe normal in 1-year-old. So the alarm should not beep when the heart rate reaches 90. So these are instrumental related safety. Unless you are tuned, unless you are unless you don't have the age specific competency to take care of it, they are really disastrous. Then intellectual disability, intellectual challenges of safety. For example, a neonatal care or neonatologist should have requisite qualification, experience, training, and education, and he should have the competency to treat these newborns or pediatric intensive care children. Then, of course, injection and infusion safeties as compared to many other ICUs and OTs, you have the safety issues. More importantly here, the dilution factors, the dosages of the medications, because most of these doses depend on the weight of the child. So accurate dosage, accurate measurement, accurate maintaining of the lines is very, very important. And IV lines are not so easy in children as compared to pediatric adult medicine. So it is challenging to maintain these IV lines also. Then communication problems, intercommunication problems. Very easy to get a patient complaint in adult medicine, whereas in pediatrics, very difficult. Everything and anything they cry. So we have to understand what are they crying for, whether they are crying for an ant in the nappy, or whether they are crying for a meningitis or a myocarditis or a earache or a tummy ache. So we need to be very, very careful in analyzing these intercommunication deficiencies or challenges. And then, of course, injection infections. They are immunocompromised physiologically. So they are prone for infections. Interventions make them prone for infections because of disastrous interventions in the natural immunity. And then, of course, all these add very much newer aspects and facets into the safety challenges which we see in pediatrics. And you need to address each and everything separately, because they are not, although interlinked, they are not in the sense once if you correct, the other will get automatically corrected. So you need to address each of these aspects when you talk about safety in neonatal, ICU, or pediatrics.
Right, sir. So, sir, in addition to this, what key steps a health system or a professional can take to ensure the safe care for the birth from the start?
As challenges are different in pediatric age group,
Yeah.
neonatal age group, you need to address these issues. The three most important aspects of safety in pediatric and neonatal care, from the healthcare provider point of view, is my sincere request is three things: avoid sentinel events, avoid hospital-acquired infections, and avoid medication errors. These are the three most common dangerous situations in pediatric and neonatal care. And if we probably take care of these three issues satisfactorily, at least I think 80% of the principle, 80-20 principle 80% of the problems can get solved by these three, probably addressing these three issues. So a healthcare worker should concentrate on preventing these sentinel events as hospital-acquired infections and medication errors, especially in pediatric and neonatal care.
Right, sir. So, do you think so? There are any innovations or strategies one could, take up for the safer pediatric or the newborn care in the next decade, or like it's already there? So, like people don't know like what technology they or innovation they should use.
Yes, the technologies probably they should concentrate on. They should concentrate on identification,
Mhm.
identification of these challenges in pediatrics, because identification itself is the first step to solving them.
Right.
So identification of the problems and challenges in pediatric and healthcare, pediatric and neonatal care need to be first streamlined. Then understanding the unique needs of children with compared to adult medicine is to be addressed. Anticipatory guidance is a very, very important preventive aspect of safety, prevention of safety challenges in pediatric age group, and that needs to be stressed upon. That is something which is not taken care of at all. Then properly and timely vaccinations and breastfeeding exclusively for 6 months is something which is phenomenal in preventing majority of problems of children. So probably the stress or innovation should address in these areas to prevent and make the to prevent safety issues and make the children a safe childhood.
Right. So, in addition to that, is there any message or a one message would you like to share, if allowed, like to the policymakers on this World Patient Safety Day?
As
What
I
it would be?
told you, avoid sentinel events, avoid healthcare associated infections, avoid
Right.
medication errors. These three, if you take care of it, it's fantastic.
Right. So, this year, since we are going for the WHO theme, which includes awareness, mobilization, empowerment, and research, from your perspective, which of these is the most urgent right now and why?
I will see awareness is the most important aspect still, because of two reasons. One, if you see the elite class,
Right.
they are misguided. The awareness what is being created in mass media and social media, many of the things are false. Many of the things are false. So they are
Hmm.
misguided, and their awareness as such is totally uh, weird, I would say. Whereas in the lower class, they are not aware. They are not.
Right.
So these are the two challenges. Probably awareness is something which we need to definitely address upon. That is the need of the without awareness you cannot implement anything. They need to be aware of what is to be done, especially understanding the unique needs, anticipatory guidance, proper and timely vaccinations, exclusive breastfeeding, prevention of malnutrition, health and hygiene, deworming, many things which probably preventive aspects of care have been taken very serious steps in pediatrics, and we have prevented many vaccine preventable diseases. So in a similar way, if we can take care of these other aspects by creating awareness in those who actually take care of these children, that is most important step, I still feel, because awareness is still lacking both in elite class and not so elite class.
Right, sir. So for our listeners, we want you to tell us like how they can get involved in promoting safe care for every newborn or the child.
Uh, yeah, the most of the hospital, like for the listeners, if you are talking about, then I think they need to strengthen our vaccination strategies. Still, vaccination strategies are still haywire. If you see the elite class, they get everything vaccination done for no reasons, whereas the poor class, they don't get the vaccination. Still, the vaccination coverage is not so high in India, and because that is one strategy which can prevent many of these childhood-related diseases. Avoiding complementary feeding before 6 months, that's where the listeners can help, so that exclusive breastfeeding is continued till 6 months. It has tremendous benefits. I'll tell you, you cannot even it's, I can say 300% or 400% return on investment by giving this exclusive breastfeeding. Then health hygiene, health promotion, health and hygiene promotion, deworming periodically, and most important, latest aspect is avoiding the screen time. And I'm saying avoiding the screen time, not in children. Most of this, because we see every day in OPD, we see at least 4 to 5 children who are screen addicted. The problem is because the parents are addicted. In front of the children, parents open their cell phone and they play, they enjoy, they laugh, they smile, they chat. So children think that this is something fascinating and more important.
Hmm.
So avoiding the screen time itself in the parents itself can reduce the screen time in children. That's what I would like to. And these things can be tackled by our listeners who are very knowledgeable.
Right, sir. Rightly said, sir. I agree with the screen time and this. So, as a pediatrician, what's the very first step you can take to make sure every newborn receives safe care from the start?
Yeah, the safe care starts as early as antenatal period or even before the conception. Nowadays, I don't know whether you are aware, we have some children who have five parents.
Okay.
For surprise, one is a biological parents, father and mother, and the sperm and the ovum donors, and then now mitochondrial donors are. We
Oh,
put we take mitochondria from one ovum to another ovum and then uh,
oh,
for mitochondriopathies. So the the safety of these children starts even before conception. For giving folic acid to the mothers to prevent neural tube defects, giving tetanus vaccination to the mother, keeping the mother healthy both physically and mentally, and prevention of anemia in the mother. From there, the safety of children starts, because prevention of prematurity itself in pediatrics is a huge, huge, huge challenge. And once they are born, of course, there are so many other preventive aspects of care that need to be stressed upon. And also, as I've already told you, all the facets of safety in the healthcare sector that needs to be taken care of. In addition to like child abductions, child abuse, social aspects, suicide, then adoption, many of these social aspects are there which need to be taken care of, because if you don't take care of it at this point, the safety becomes a challenge in all these things. For example, an adopted child is being abused. We have seen so many patients. So that's also very, very sad story, sad state of affairs. So we need to take care of the safety in each and every aspect. And one point I would like to stress upon here is the unique needs of these patients at different age groups. For example, a 10 months old explores the world by putting everything into the mouth. It is his birthright that he will explore the world by putting everything into the mouth. And so, as a caregiver, as a parent at home, it is our responsibility not to allow anything that can cause harm or that can be a safety aspect within the reach of the children. So, anticipatory guidance in such situations will definitely help. So, these are the aspects of safety which need to be taken care of.
agreed, sir. So, last question for this conversation is again for the caregivers and the parents. Like, how can they actively contribute to make safer care for their children? Not only the newborns, but till the adolescents and the toddlers also.
Okay, one thing is adhere to what your pediatrician says, adhere to what guidelines say, vaccination strategies. It can be even government vaccinations, that's fine, but adhere to these things, what they say. Prevent malnutrition, maintain health and hygiene. And if you have any challenges and you have come out of it, share these success stories so that others also will get motivated.
Right.
And that is form a support group to educate each other, to motivate each other, and to prevent the calamities in pediatric safety. That's fine.
Agreed. Agreed. Thank you so much, sir. Sir, any last message you would like to give to our listeners? So,
Be safe and make your children safe. Thank you.
thank you. Thank you for joining us today on this special podcast. Thank you so much, sir. We hope this conversation has highlighted the importance of safe care, quality care for every newborn and the child. Let us all work together for the healthcare providers, families, and communities to make healthcare safer from the very beginning of the life. I am Dr. Sonali, scientific editor. Thank you for listening. Thank you, sir.
Thank you for this unique initiative. Thanks so much.
Thank you, sir.